Hey guys, welcome back to Medical Coding with Blue. Today is Q&A Tuesday. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I hope that by sharing the knowledge that I have in this medical coding field that I've been in for over 10 years, that it will help you whether you are a new or a veteran coder. And I hope that you'll hit that subscribe button. I hope that you'll like it. And I hope by the end, if this has helped you, I hope you'll share it with somebody that you know or somebody that is getting into the medical coding field or is already a medical coder. All right, so let's go ahead and get started. All right, these are all the questions that I've gotten through emails, through comments, through my Instagram, Medical Coding with Blue. There's many ways to get in contact with me, and I will leave all of my contact information down in the description box below. So let's get started. All right, the first question is, would medical coders be considered essential workers during this pandemic? Yes, we are considered essential workers. I will actually be doing a video later this week about why we are considered essential workers and some of the things that we do as functions of, what we do in medical coding. Now, yes, we are considered essential workers. There's a follow-up question to this. Do most of them come into the hospital or clinic office and or work from home? Currently at my facility, they have us working at home. So we've all remoted in. We have our computers. We basically we signed them out, and we came home and we all got set up, and we've been coding at home ever since. And there has been a drop, which was the next question. How is the workload compared to being in the office versus being at home? Our production standards are still the same. We have to complete 90 per day on average to consider, meeting production standards. We do have a significant drop right now in encounters that are coming in because elective surgeries had been canceled and all really non-essential appointments had been put on hold during this time. So we are supposed to be having elective surgeries start to happen again really soon. So I'm assuming there's going to be an uptick. But right now, everything's really at a low. I'm just catching up on some older encounters right now, and just really concentrating on the things that are coming in. I still have plenty of work to do, so that's not a really big concern for me. There are some facilities that do have some coders on hand, I'm sure, but for the most part, me and my facility, we are all at home, and we will continue to be at home until the order is lifted or until they deem us safe enough to get back into the hospital. They really wanted to minimize the impact on having additional people in the hospital. So they really made a wonderful effort of getting everybody out of the hospital that really essentially didn't need to be there. So all the secretaries and the admin staff and everybody really got all sent home. Pretty much it's all hands on deck when they're at the hospital. So if they have a function that they can be hands on deck in case there is, a surge of patients, they will be prepared, and they will be, there will be less people in the way, essentially. So, but yes, that is the answer to that one. And like I said, I will be speaking about why we are so essential later in the week. Okay. The next question is, address the exact payment questions about AAPC. Guys, I am certified with the American Health Information Management Association. There are two major medical coding powerhouses, okay, in our world, okay? The American Health Information Management Association, or AHIMA, and the AAPC, which is the American Academy of Professional Coders. Now, they're two completely separate areas, right? And I always talk about that I am involved with AHIMA. I do talk about AAPC only because I want to let you guys make your own decisions, and I'm trying not to be biased, okay? I do that because I feel like you guys can make your own decisions about which association you want to belong to. I really do recommend, especially when you are in the beginning, to go with one association. Do not try to get credentialed through both because you think maybe it will help you to get a job faster. If you're going to go the multiple credentials route, you really do need to have time in already, and you need to have experience already to back up the reason that you have all of these credentials. Because yes, you can have all of these credentials, but if you don't have any experience behind it, it's really not going to do you any good if you're out there trying to find a job. Okay. So with that, I did get an email from somebody that asked me, can you give me the exact payment for AAPC, because they wanted to register for the test, but they didn't know if they needed to pay for the membership. Guys, I'm not a member of AAPC, and I've said it several times, so I'm saying it again. I'm not a member of AAPC. You guys have to ask AAPC these types of questions. And AAPC, I will tell you guys, is very responsive because I go in there, right, on their website just to do research for my show, right? Because, like I said, I try to bring you guys information from both associations. That way you guys can make your own decisions. But I go to the AAPC website and they're in my face, like, how can we help you? How can we help you? Are you ready to become a medical coder? I'm like, I just need information. And I'm just looking through the website. So they're very responsive on there. If you have questions about AAPC, ask AAPC. Okay, so there. That's the answer to that one. All right, next question. When interviewing for medical coding jobs, what type of questions should I be prepared to answer? I am a nurse trying to transition to medical coding. So you have to be certified first. Whether you are a nurse or not, you need to have your credential first. You have to have your medical coding credential. Whether you go through AHIMA or AAPC, you have to have those credentials behind your name. Yes, you are a nurse. It's very impressive when nurses want to be medical coders. I am a strong, huge advocate for nurses becoming medical coders, but you still have to have your medical coding credential. If you don't, sometimes they'll say, well, you have to have it within a year. And that's reasonable, okay? But at the same time, you know, what nurses do in their functions as far as coding goes, like documenting and things like that, you're still not having to look up diagnosis codes. And if you are still looking up diagnosis codes, yes, I do diagnosis coding, okay. But selecting a diagnosis code like on a sheet or something, or like a cheat sheet, or like this is the range of codes that we use, that's not the same as coding, okay? I just want to make that clear. That's not the same as coding, okay? That's just selecting something that's already been pre-listed for you. That's not the same as coding. You still have to know and understand all the rules when it comes to medical coding. So yes, while nurses can make wonderful coders, they still have to be trained to think and look at documentation like a medical coder. A lot of times I have trained nurses before, and nurses tend to put their nurse hat back on. And they look at things like a nurse would, and they say, oh, and they start picking up all these things that are not there. With medical coding, you have to pick up what is documented. What does the documentation support? What did this provider do? You can't just infer. There are very few things that you can infer. But again, if it's not documented, it didn't happen. And that's something that all nurses need to know if they're going to go from being a nurse to being a medical coder. It is a good transition, especially if you are maybe wanting something that's less physical, or maybe you just sort of don't want to deal with patients anymore, and it's understandable. And sometimes people have a hard time with direct patient contact. So for whatever reason, they want to get into medical coding, and that's okay. But just know that if you want to go from nursing to medical coding, you can't just skip the part where you have to get credentialed. You got to get credentialed first. You have to. I mean, there's no getting around that. Okay. So next question. How do you get your providers back in line, or how do you set the rule of providing? Can you set the rule of providing? I wrote something and I don't even remember. Okay, how do you get? Okay, well, essentially, what they're trying to ask is, how do you get your providers back in line, or how do you set a rule so that your providers are not delaying you with your work? Okay, that's essentially what I was writing. I'll look back on the question later and think, how did I flub that one up? Okay, so a lot of times I talk about my providers in my videos, and I talk about, that I have to query them. And so basically the viewer wanted to know, how do I get them back in line? What is the trick? What do I do? I have worked with my providers for a long time, and even for my new ones, I have a set way of doing things, which is I get to know them. I get to know them, and this is very important, and this is key. They need to be able to trust me. That's number one. If they don't trust you or if they don't think you know what you're doing, they're not going to listen to you. That's number one. Sometimes they fall off, and that is just because of whatever's going on with them, their own personal life, whatever, what have you. Okay. But in order to get them back in line, you need to make sure that you have already established that trust and that they know that you know what you're doing. Okay. That you're not trying to sit there and be unsure and, maybe this and maybe that. You come at them with respect above everything else. They are extremely educated, and because they're extremely educated, they are smart. And because they are smart, they're intelligent people think differently. I mean, when you have that amount of intelligence, you're going to think differently. And whether it is that you think you know more than everybody else, or that the basic things are harder for you to grasp. There's a difference when there's somebody that's really intelligent and communicating with them. Okay. So when you are coming to them, you do need to be respectful. I do make sure that I do regular little bitty coding tip of the week so that this constantly stays with them. But when I do have a provider that falls off, I do let them know one-on-one. I'll send them an email and I'll send them a query and I'll ask them, can you, would you review this and make, and answer the following questions or whatever, or do your updates or whatever. And if they come back and say, no, it's already there, and then I'll explain or I'll show them something that will support why I need this information. Okay. And if they still come back and say, well, I just don't understand why we're not doing this. And then I will point out a regulation, and that's the third time. Okay. It's the third time if I've had to go back to them. It's the third time. And usually I will go to them face to face, but right now, because of the pandemic, everything has to go by email, and which makes things harder, because there's no way to have that one-on-one connection. So sometimes they take it for granted that, oh, she can't come get me. She can't come talk to me, because it's a lot easier if I can sit there and go to your face and talk to you. But because I have to go back and forth through email, I give them a 3-strike thing. Okay. If I have to go back and forth with you 3 times to explain something, and I've made this clear during meetings, and I'm not mean about it. I am very clear about these things, because I tell them, guys, I need you guys to help me. Help me help you, because my goal here is to make sure that you're getting credit for everything that you can possibly get credit for. Now, they are among the most high performing in the hospital. They've had, their numbers broken down. So I do tell them this. Guys, y'all are the most high performing in the hospital. The reason that y'all are high performing and more performing higher than anybody else in this whole hospital is because I care. I'm your medical coder, and I am trying to make sure that you guys are well covered and that you understand everything, because you can tell them to do something, but you really do have to explain to them why. They need to know that why part. I said, if I have to go back and forth with you, I'm only going to go back and forth with you up to a certain point. And then I will let you know when I am done. Because, and they usually kind of look at me like, really? Well, here's the thing. I'm very patient, but if I've had to go back and forth with you 3 times and you're still refusing, that's fine. Then I can put on there, the provider has been queried. The provider refuses to respond, and I will code what is there. That's it. There's no fooling around at that point. I'm not one and done. I will work with the provider. If the way I'm explaining it doesn't make sense, I will stop and try to explain it different ways. I will bring whatever information is that is supporting the reason that I'm sending this query. And like I said, at the end of that 3rd time, then I will inform them, okay, if you choose to not respond to this query, that is fine. I will go ahead and submit with what is there. If there is no credit, there is no credit. And that usually gets their attention when they know they're not going to get any credit, because they get in trouble for that too. And it has a lot to do with the leadership as well, making sure that the leadership holds the providers accountable. Sometimes these providers will be punished for their RVUs that are dropping if they are not meeting a certain level on their RVUs like they're supposed to. And RVUs are relative value units. Everything that they do, all the procedures and evaluation levels that they perform, they are weighted. Okay, and that weight is called RVUs. So the hospital uses that as a generator to understand, excuse me, how much revenue this particular provider is potentially pulling in, because all the insurance companies, pay their different rates and things. But with the RVUs, it'll give them a standard, okay, of how much of these things that they're generating. And like I said, they have a goal to hit. When they hear that they're not going to get credit, then they start paying attention, because they know that I mean business. And they know that I mean business, but sometimes, like I said, they get into their moods where they just like, okay, I don't want to do anything. I don't think that I need to explain myself to somebody who is not a doctor. I don't answer to you. And yes, you don't answer to me, but I'm your partner and I'm here to help you. And that's the thing that they know. They know. And then usually they'll apologize. I've had all but 2 apologize to me when they've done that to me. Yeah. So, I mean, and sometimes you'll have personality conflicts, but it really does depend on how well invested you are into learning how to effectively communicate. You have to effectively communicate with your providers, especially when they get like that, because they will get defensive. But that is just something that you have to work on, and you have to get them to get back into the course. And even if it means sending little reminders every week, I do my coding tip of the week every week. And just because being at home has not stopped that coding tip of the week. So I still make sure that I send out a little something every week, a little reminder about this, a little reminder about that. Or I'll give them a particular scenario and I'll give them the answer and say, this when this happens, you're looking at orthopedic aftercare. Or when this happens, you're looking at injury aftercare or injury diagnosis when you're working in the aftercare. So a lot of that has really helped to make sure that they can stay the course. And giving them little bits at a time really does help, because you never want to overwhelm your providers with a bunch of information. But yes, that is, and I'm going to have to do a whole episode about that. I think it'll probably be next week, about provider communication. I think that would be something good. So, inspiration. All right, next question. When I graduate with honors, I will have my CPC certification and an associate's in administrative medical billing and coding. Am I going to only make pennies? That question is a little insulting. And that's number 1, okay? Number 2, I don't talk about money on my channel. You all know that. And if you don't know that, if you're brand new, the reason that I don't talk about money is because 2 reasons, really. First, everywhere in the U.S. is going to make different amount of money to start, okay? That's number 1. Depending on where you're applying to, public, private, government, it's going to all be different. Okay, every place is going to be different. Number 2, I'm not going to sensationalize medical coding as far as like the salary you can make. There are people out there that do that, yes. To me, it's a little ridiculous, because when you tell people that this is what you're going to start at and it's going to be some ridiculously high amount, I get upset, because the thing is, that's for people that have been in it for a long time, that have lots of experience, that really know what they're doing. This is not something that's quick and that you're going to be able to learn all this stuff like overnight, and then you're going to be this stellar coder, and then you're going to be able to make all this money. It's ridiculous. Let's be real, guys, okay? Look on the Department of Labor or the Bureau of Statistics, and I will include those links down in the description box below. That will tell you, when you put in your zip code, what the starting salary is for the medical coders in your area. Okay, so that is a good place to start. And a lot of people get mad when I say this, but I'm being real with you guys. I don't have any reason to lie to y'all. I don't have any reason to try to sell the field either. I'm just telling you about the field. And as far as like how much salary you're going to be making, you really should know that before you start a program. This viewer is already almost done, and they're going to be taking their credential exam. Why would you be asking that question now of all times? I'm just saying, know what you're getting into before you're getting into it. And I even give advice on my channel. If you look through my videos, you'll see where I have advice of what to know before getting into medical coding. And knowing how much you're going to make, doing your own research is really a big part of that. Okay, so that's the answer on that one. Are AHIMA or AAPC credentials valid in the UK? I don't live in the UK. Okay, I live in America. I live in the US. These are the two major powerhouses for medical coding. They're having a credential with them says a lot. It says that you can pass your certification exam, and it says that you know what you're doing, essentially. So whether you are in the UK or here or Canada or wherever, I mean, these are worldwide. I mean, it's not something that's only specific to the U.S. I mean, really, you have to know where you're applying and what they're looking for. But if you are if you want to be a medical coder, or if you're a medical coder and you're credentialed through one of them, that's what you need. And that's really what people are looking for. Is when they're looking for medical coders, they're looking for them to be credentialed through AHIMA or AAPC. Okay. Next question: can anyone do self-study, or do they have to study with an institution? You can do self-study. Both associations have beginner level medical coding credentials. So I've done plenty of videos about that, doing independent self-study, and I'll probably link it down in the description box below. But yes, you can do independent self-study. All you need is a high school diploma or a GED. Okay. The next one is, I went to school for medical billing and coding and finished, but I didn't do my test for coding back in 2013. Will I have to go back to school, or can I take the test without going through the program again? If it's been since 2013, that was ICD 9 times. We are now in ICD 10. Yeah, you're going to have to go back to school. Okay, even if you went in 2009 and you studied it back then and you didn't take your credential, or you didn't maintain your credential, you are still going to have to take the program again, because we are in a completely different code set. ICD 9 is no longer existing anywhere. We are in ICD 10. Okay, so yeah, if it's been that long ago, yeah, you have to go back. Okay. The next one is, are your eyes affected from staring at the computer screen? If I don't take breaks, if I don't move my eyes around, then yes. It's just like anything else. You just have to give your eyes a break. Typically in an 8-hour day, we have two 15-minute breaks. So I do make sure that I take those two 15-minute breaks. And I do make sure that I move my eyes around when I am looking at the screen, so that way I don't get those tired eyes. So yeah. The next one is, you mentioned that you got a job through a temporary office. What does that mean? A temporary agency is what I said in the video, and a temporary agency is they hire temporary workers, to fill in for wherever they may need help. In my particular instance, I applied at a place that was for temporary workers for the medical field. So they hired nurses assistants and nurses and doctors and medical coders to temporarily fill in. That's what a temporary agency is. I thought every place in America has them, but I don't know. I guess maybe some places they don't have them. But yes, when you are out there applying, I would apply with a temporary agency as well, because a temporary agency is basically in charge of putting people in a position temporarily. So they're not going to need all that background, right? All that experience and everything, because they just need basically a body to fill a seat for a very short amount of time. But guess what? When you're a medical coder, that's the best thing for you. But you know why? Because that puts filler on your resume. This says that you did an assignment at this place and this place, and you applied codes, and that's what they're looking for. So I'm just saying, don't knock the temporary agencies, okay? Look for a temporary agency in your area and apply with them, so that way you can try to get some experience somewhere. Even if they send you out on a one-day assignment, doesn't matter. You still are making a connection somewhere, okay? And that you still have that experience to put down on your resume. I'm just saying, okay? And then the last question is, do you have to be fast at typing? No, but you do need to at least be good at 10 key by touch. You know, that would really help you. But you don't necessarily have to be fast at typing. You will have to type emails, but it's not, you know, like where you like it's gonna be timed or anything like that. You know, so if you're a slow typer, it's okay. You will get faster because you will have to spend time, you know, typing. But like I said, 10 key by touch is really what you really want, because when you're entering in codes, you know, that's gonna go along with that. So that's my show for today. I hope that you've already hit that subscribe button. If you haven't, hit that subscribe button. And the thing is, I hope that you guys continue to submit questions. These have been great. Please let me know if you have any suggestions for shows as well, because I try to do things to cater to you guys and what you guys want to know, because what I think is pretty clear is not clear to a lot of people. So feel free to let me know if you have any suggestions for show ideas, okay? So I'm going to wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.